Aibowan, and a very good evening to all our viewers here on TV1. I'm Dr. Dilshan Fernando, and this is your weekly dose of wellness here on Healthline. Today we are going to be talking about a topic that's common among the elderly population, and that is none other than the condition of osteoporosis. And to talk about this condition in depth, we have invited back to the Healthline studios Dr. Kelum Pelpola. He is a consultant physician and a geriatrician. It's a great pleasure and an honor to have you back, sir. Thank you very much for gracing the Healthline studios.
Thank you very much for inviting me.
So, as I said, sir, today we want to talk about osteoporosis, and we
Yes.
know it is somewhat of a common condition when we consider the elderly population. But before we get into that, if you can elaborate, what is osteoporosis?
So, osteoporosis is a condition of the bones. It affects the texture of the bones.
Okay.
So, it tends to make the bones more brittle. So, as a result of that, people can end up having fractures. So, if you look at how the bones are made, there's a constant making and dismantling, if you put it in simple terms. So, there are osteoblasts which help to make the bone, while there are osteoclasts which eat up the bone. So, there's a constant to and fro between the two, and it helps to make the texture of the bone. So, however, what tends to happen in osteoporosis is the bone mineral density. If you now go into a bit more scientific terms, the bone mineral density tends to get affected, and when it goes down, the ability for it to withstand any stress goes down. So, with that, fracture of the risk fracture goes up.
Right. So, as I said, sir, it is more common in the elderly. But is the age the only risk factor towards osteoporosis, or are there any other certain predisposing factors which leads towards this condition?
So, if you look at the different factors which affect osteoporosis, age is one, but then again the fact that when you get older, what tends to happen is in ladies they undergo menopause. So, what tends to happen at that time is that the amount of estrogen in the body goes down. So, there is a bit of estrogen support that is required for the bones to maintain their function. So, when this support goes down, the bones tend to become more brittle. So, then you see that compared to their premenopausal ages, after menopause, their bone mineral density goes down and the fracture risk increases. You do not have a marked time where men go into a similar period like that, but when they get older, it can involve having lower doses of testosterone in the body. So, what tends to happen is that when you have that loss of support from testosterone, your bones can become brittler as well.
Okay.
So, estrogen and testosterone loss can cause that to happen. So, that is why when you get older, you tend to get this more commonly compared to a younger age. However, even in younger people, sometimes you can tend to have this due to severe malnutrition, conditions such as anorexia, where people cannot eat as they should do, and if they are doing a lot of smoking, it's also associated with taking a lot of alcohol, and then also if you are taking a lot of medication such as steroids, those can also affect your bones and can make your bones brittle. So, when you think of all of this, there are factors other than just age and the hormonal support which could affect your bone health. And at the same time, last but not least, vitamin deficiency such as the vitamin D deficiency, the most important, and the calcium deficiencies, they can also make the bones brittle, and they can cause you to have osteoporosis, because vitamin D and calcium are very important in bone health.
Definitely. And now, when you spoke about the nutritional deficiencies and the vitamins and minerals that are required for the bone health, this is a question that most of our lay community has on what they should be eating, what kind of supplementation they should be taking, because we see a whole host of products out there in the market which claim to have a protective effect over osteoporosis. So, as a specialist in this area, what is your recommendation? What should we eat? What should we avoid? And are these supplements really working? What is your opinion?
So, what we need to realize is that vitamin D and calcium are very important for our bone health. So, anything which has vitamin D and calcium is useful in your diet. So, there are natural ways of getting vitamin D and calcium as well. Say for example, dairy products, you can get quite a bit of calcium. If you eat small fish where you eat the bones of them as well, then you can get calcium in your diet. Then there's vitamin D as well. Certain types of seafood, mushrooms give you vitamin D. Then apart from these, there are fortified foods as well. Say for example, they may be dairy products. Sometimes certain types of soy milk may have been fortified with calcium or vitamin D. Margarines, butters, there are a whole host of products. So there are natural ways of getting vitamin D and calcium, but at the same time there are fortified ways as well as supplements as well. So the important thing is getting the vitamin D and calcium into your body. You could do it via your normal natural diet, but at the same time you can take any supplements or any additives as well.
Right. So, talking about vitamin D, sir, now apart from what we get in our normal dietary intake, as we grow older, is it indicated for everyone to take some vitamin D supplementation? Is it really required, or does it have to be in consultation with your family doctor or your treating physician?
I think it would be important to have a chat with your family physician or treating doctor first before taking the supplements, partially because we may need to see whether they are required in the first place. Say for example, if your diet is poor of this vitamin D and calcium, then you may need to actually have it supplemented as tablets. But say for example, you are having adequate amounts in your diet already, you may not require it. Say vitamin D is, the other thing to remember is that vitamin D is a fat soluble vitamin.
Okay.
So if you take a fat soluble vitamin in excess, it can cause toxicity. Say compared to vitamin B and C, vitamin B and C they are water soluble vitamins. So even if you take it in excess, it may go out with the urine. But lipid soluble vitamins such as A, D, E and K may not go off like that. So if you take too much of it, it can cause toxicity. So I have had encounters with patients who've been on these supplements for years. Say for example, if you take vitamin D a bit of a high dose for a long time, that may cause hypercalcemia and related side effects. What we have to realize is that vitamin D is very helpful to absorb calcium in the intestine. So that is why vitamin D is important also in osteoporosis as well. So when you have too much of vitamin D, there's too much of calcium also invariably. And that can cause different side effects, and it may cause you to become constipated, sometimes confused, having bone pains, kidney stones, things like that. So I do understand that there may be a need for some patients to have it as supplements or tablets, but always start it after discussing with your treating doctor or your family physician, and it may be worthwhile on and off checking whether you actually need to continue, whether you need to do something like a level of vitamin D or calcium, and whether you need to actually continue it long term or only short term, because it may be just a short term thing if you can just supplement it via food. So always when taking things like this, it would be advisable to be in touch with your doctor and check at least every 6 months or so whether you actually need to continue with it.
Definitely. The reason why we bring these kind of programs to you is to enhance your knowledge about common conditions, but definitely not for you to self prescribe based on what we discuss here. So, always when you take some medication, it should be in consultation with your treating physician. So, moving on with the same subject of vitamin D, so we know it's common knowledge that sunlight gives rise to a reaction in the body which gives us vitamin D. And being from a tropical country, it is a common belief that if we go out in the sun in the morning, that should help us or support in getting us the required dose of vitamin D. But when we say going out in the sun, there can be a misconception of just a 10 or 15 minutes stroll out in the sun. People may think, okay, I am getting my adequate daily dose of vitamin D. Is that the case, or is there a particular duration that should be there for us to get vitamin D from sunlight?
Well, when you talk about sunlight, sunlight is helpful in getting vitamin D, that is true. And what you need to realize here is that it also depends on your skin color. Say if you have too much of melanin in your skin, which then you have darker skin. A lot of people in our country tend to have darker skin compared to Caucasians or European people. So what we see is that if you get to the same effect, you may have that effect in 15 minutes in a person who has white skin, but to get the same effect you may have to stay about 1 hour or even 2 hours if the person has a darker skin to get the same amount of vitamin D. So that means that's a quite considerable amount of time, and generally we may not stay that long in the sun, and it is not practical to do that too. So there may be certain occupations which involve working in the sun for long hours, but apart from that, especially suburban populations, they work a lot in their offices, they are indoors most of the time. And if you compare people who are elderly, they would be mostly inside their house rather than outside, due to various reasons: the false risks, the fact that they are bedbound, the fact that they are feeble and cannot walk much outside. So especially when you are quite elderly, it is very important to make sure that you get the vitamin D in other forms if you are not going out in the sunlight. It could be diet, it could be supplementation.
So that's a very interesting fact that Dr. Pelpola highlights. Even though we are living in a tropical country where sunlight is in abundance, because of darker skin color with the melanin, it is known to be that we should be out in the sun for about an hour or two to get the required vitamin D supplementation. So, as Dr. Pelpola very correctly says, it might not be very practical for all of us to do that, unless of course you are engaged in some activity or an occupation which requires you to do so. So, moving on with the topic of osteoporosis per se, sir. Now, what would be the symptoms that one would experience when they are getting osteoporosis, or is it only when they come with a pathological fracture so that we know that okay, this person has got osteoporosis?
Well, talking about the symptoms, osteoporosis is supposed to be a silent disease. You would not get a particular kind of symptom in osteoporosis. Most of the people who realize they have osteoporosis is when they have a fall or fracture, and or when they do a scan to find out their bone density. So it is we are not able to identify osteoporosis apart from when you do a scan. Because of these facts. So you may not know it until you actually have it and have a fracture.
Yes. So based on that, sir, now as we grow older, how do we screen for osteoporosis? You mentioned about a scan, and are there any other investigations, and when should we start screening for it, and how often should we do it?
So different countries have guidelines regarding this. Say for example, in countries like the UK, anyone who comes with a fracture neck or femur, depending on their age, especially if they are female, they have guidelines of how to screen them and treat them. Say for example, if someone is more than 75 years, has presented with a fracture neck of femur, so that is a hip fracture, they would straight away be started on bone protection. They would not even require a scan. But at certain age groups, they would say we would rather look at the scan, see whether you are osteopenic or osteoporotic, and then start. So, osteopenia is something which you get prior to getting osteoporosis. So, there is a normal bone, then it goes a bit below than that to osteopenia, then it goes a bit below than that to osteoporosis. So, during osteopenia, if you do the corrective measures, you may not get osteoporosis. But as I said, the actual scan which you do is called a DEXA scan. So, it looks at the bone mineral density. What you actually do in it is that you compare your bone density to the bone density of a young healthy adult, and then see how far you are away from that. If you are only a little bit away from that, you may not even have osteopenia or osteoporosis. But if you are a certain amount, when you come to a certain amount, you say it's osteopenia. When you come to a bit down from there, you call it osteoporosis. So, there would be a consultant who reads the scan and say whether there is osteoporosis or not. Different doctors tend to do it in different countries, endocrinologists, physicians, geriatricians, different types of doctors in different countries tend to do these kind of things. In Sri Lanka, you see a lot of doctors of all these categories tend to do this, as well as some orthopedic surgeons also tend to do this.
So, when should we actually, for screening purposes, let's say a person doesn't really have a pathological fracture, is it really indicated that as you grow older that you should do this on a regular basis, or at least once to get it checked, and if so, when should they do it?
It may be a sensible thing to do, especially if you think of risk factors. If you have certain risk factors, if you are prone to having fractures, if you are having a family history, those things are also very important. So, some people have family histories of getting hip fractures. If you look at the fractures that you can get from osteoporosis, there are three main areas identified. One is the hip, one is the spine, the back, as well as the wrist. So, you see all these three kind of fractures which happen to people when they become old. So, most of the people when they fall, they may fall on their hip and fracture their hip. And some people fall on their outstretched hand and then get a wrist fracture. And some other people can get a fracture of the spine, probably the lumbar spine. Lumbar is the bottom back spine. That can happen without anything. If your bones are brittle, it sometimes even can happen when you have a violent cough or when you just bend down. Sometimes it can happen after a fall too. Some people only realize they have had a few fractures when they have chronic back pain which goes on for some time. But then the fracture is a result of the osteoporosis. So, I think if you have all of these and if there is a risk factor, when you get older, I think it is prudent after having a discussion with your doctor to go for a scan like that. We see that certain hospitals tend to include these in their packages as well. But if you have a doubt, always have a chat with your treating doctor to see whether that is indicated. You cannot say that you can't give a blanket term that everyone should have one. It also depends on your circumstances. So, I feel if you have the risk factors, have a chat with your doctor and then go ahead with it if required.
Of course, prevention is always better than cure, they say, and in consultation with your treating doctor, if the doctor feels that you have any predisposing risk factors, any family history and all the other conditions that we discussed, it would always be prudent to get yourself checked to see that you have any risk or whether you are already osteoporotic. Now, talking about prevention, sir, in a patient with osteoporosis, we discussed about falls.
Yes.
This is something that leads to very debilitating effects in the elderly population, make them bedbound, and along with that so many other complications occur. So, for the benefit of our viewers, we discussed this about this when we did the program about elderly care as well.
Yes.
How should one be careful when the elderly to prevent falls at home, and what kind of precautions should they take?
Yes, I think it's an important question because falls are the main reason the elderly end up with fractures. So, as we discussed, it could be a hip fracture, a wrist fracture, or even the fracture in the back. However, you may also realize that sometimes there is treatment for osteoporosis and people get treatment, and despite having treatment you still can get fractures. So, that is a possibility. So, the intention of the treatment is to reduce the chance of getting a fracture, but it does not totally eliminate it. So, that is why prevention of the fracture is also important, and why it is important to prevent falls. So, in the elderly you can see that there are a lot of causes for falls, but some things are very simple things. It just could be something like their eyesight, it could be something like just increasing the light in a particular area, it could be something like making some changes in the house. Say for example, in the bathroom you could just add a rail for them to hang on to when they are having a bath, or just getting up from the commode, and making sure that there is no excessive water on the floor so that they would not slip. Those things are there, those are the basic things that we could do, but at the same time, if by any chance your adult has had any unexplained falls or any loss of balance or inability to walk, which is getting worse with time, these things need to be addressed and nipped in the bud early if possible. So, there are things which could be done. Say for example, if you have a certain condition such as postural hypertension, I am just taking one example. Postural hypotension is a condition where your blood pressure tends to drop too much when you stand up. However, the solution may be a simple one, because you may be sometimes on a lot of blood pressure medication which can affect your blood pressure, and it can also affect your blood pressure when you stand up and make you feel dizzy and fall. One thing I tend to see in a lot of patients is that they have been on the exact same medications for about 10, 15 or even more years. Sometimes it is important to look at these medication and to see whether they are actually required, and de-prescribe if necessary, and then see whether we can actually make the patient feel better as well as get the parameters correct. So, as I said, prevention is better than cure, and falls prevention is very important, because as I said, even while on treatment you can still get fractures while having falls. So, if we reduce the number of falls, the debilitating effects of osteoporosis can be reduced.
Of course, that's very important facts coming from Dr. Pelpola. Simple measure can go a long way in helping a person, because if an elderly person is bedbound, that will lead to a whole host of other complications which come along with it. Just treating the osteoporosis is not really the solution, but we have to take these precautions to make sure that they don't end up with a fracture and end up in bed. Now, talking about osteoporosis, you spoke about the treatment, and is it like lifelong treatment, or do you have to take it for a certain period and get checked whether treatment can be stopped? How does that work?
So, basically as I said, vitamin D and calcium replacement is done if required, but at the same time there are drugs which help with bone protection. So, there is a drug or a tablet called alendronic acid. For example, you take it once a week. So, in the same class there are other drugs called ibendronic acid, zolendronic acid. So, some of these drugs are taken once a week, some taken once a month, some taken once a year. So, it depends on how the patient is. Say for example, there may be patients whose swallowing is not that good. Then you may prescribe them maybe an intravenous treatment which you give once a year. while some others you may give it once a week. But having said that, even these medication for bone protection, the current recommendations are that after about 5 years you may take a drug holiday and actually assess whether you actually need it. So if you are on a medication like that, check with your prescribing doctor as to how long they want it to continue, because as you know, every drug has its side effects as well. So drugs like alendronic acid can cause conditions like gastritis to get worsened. So normally when you give this drug, you give special instructions. Normally you tell them to take it once a week, probably a Sunday, because it's a relatively easier day for them to take it. And then you take it first thing in the morning, and for the next 30 minutes you have to be upright, that is seated or standing up, but not lying down flat. The reason is that because if you lie down flat, you may get your gastritis worsen, and or it may cause burning of the gullet, and you may get a bit of gastritis symptoms. But if you for half an hour are upright, either sitting or standing, then you should be fine. And generally for that half an hour or even for 1 hour, you are recommended not to eat or drink anything. So that is how alendronic acid is taken. But then again, in some people it can cause a condition called osteonecrosis of the jaw. I'm not telling very common things, these are uncommon things, but it's better to know. Say for example, because of that you are asked to get your dental work cleared up before sometimes starting any of this medication. Say for example, there have been very rare instances where people ended up with fractures of the jaw while having dental treatment. So when you say dental treatment, it is not something like simple things, some things like flossing. It would be something like taking teeth out or doing any drilling work or anything in the jaw. Those kind of things are the important things to think of. So if you're on this treatment and if you're going to have any kind of dental work, you need to tell your dentist about it. And some people, they have reported, have had proximal femur fractures, that is the bone which comes down from the hip. There may be some fractures in there in certain people, but if you think of the benefits and the risks of taking the drug, the benefits outweigh the risks, and the side effects are fairly well tolerated if you adhere to the instructions of how to take the medicine. And generally, even things like osteonecrosis is quite low in incidence, but it's good to know, and so that you can tell your dentist about it when you're having any dental work done.
Definitely. Now, especially in the Sri Lankan setup, we see that once a doctor prescribes you a certain type of medication, you tend to take it over years at end, but the principle behind it would be a certain drug should be administered in a certain dosage for a particular set period of time. Especially what Dr. Pelpola said about deprescribing, especially for conditions like high blood pressure, we see even the more educated population tend to hang on to the medication and take it over years at end, but that should not be done. It should always be taken, there should be regular follow-up visits with your doctor so that it can be regularly revisited whether you actually need it. And personally, on a personal note, I have seen Dr. Pelpola do it so many times with patients, taking off medication, which is another clinical decision which is very, very important in treating the patient, as important as prescribing the medication. So, as we come to the end of the program, sir, we know if not properly treated, osteoporosis can cause fractures, but are there any other complications that may occur if it's neglected?
Generally, fractures are the main thing that you tend to see. So I think what people tend to realize is that once you have a fracture, it can be debilitating. But having said that, with how orthopedics has progressed over the last few years to a decade, I see even after a fracture, a lot of people walking on it the same day or even next day. So it's not a doomsday that if you have a fracture, it does not spell end to your life. It is much better. Say for example, if it was about 30-40 years ago, things would have been different. people may have been bed bound, not been able to have operations done due to various factors. But I've had instances where when I have worked in the UK, we would have operated on even 100-year-olds. And even in Sri Lanka, I am seeing the trend. Not that, especially if someone has had a good quality of life, age should just be a number, and the aim would be to get them back to what they were as quickly as possible in the safest possible way. And that, because of that, has reduced the amount of issues which we expected with these kind of fractures, especially hip fractures. There are a lot of fractures in the spine in a lot of older people, and they tend to tolerate it unless it's severely painful. So some people tend to have a few fractures and it can be really painful, and that can affect their day-to-day activities and all as well. And if you look at how to get over it, it would be mostly painkillers. And sometimes taking painkillers, especially in elderly, would not be a very good thing. It may affect your kidneys and cause you to have kidney problems. And they have other effects. Say, for example, some drugs may cause gastritis and may worsen gastritis. There would be some drugs which may cause constipation because of the pain. Although they do the pain relief effect, they would also give the side effects of constipation. So all of these things can be avoided to a certain extent if you have good bone health. So that is, I think, the take-home message. But at the same time, if you have a fracture, what you need to realize is it's not the end of the world. There are plenty of good doctors among us who can fix things. But even say if you have had a fracture and if you had an operation done, then you may be given long-term medication, say vitamin C, vitamin D, calcium, as well as bone protection. And the idea of doing that is, although there is a fracture now, you are trying to reduce future fractures from happening. Because sometimes you may see a person fractures one side and falls the next day and has a fracture on the other side. So that's what you are trying to prevent by giving these kind of medication.
Definitely. Osteoporosis is quite a common condition, especially among the elderly, and it was a very interesting discussion, and I think it was very informative for our viewers. So I thank Dr. Pelpola very much. Thank you very much, sir, for gracing the Healthline studios.
Thank you for inviting me.
So with that, it's time for me to wind up from this edition of Healthline. As we all know, Sri Lanka is going through very troubled time these days. But again, as we know, Sri Lankans are very resilient, and we have to persist. We have to face these troubled times, and I wish you all the strength to persevere and come out strong. We are all in this together, so let's face this and try to come out strong. With that message, I take your leave. Until I meet you again next week with your weekly dose of wellness, this is me, Dr. Dilshan Fernando, wishing all our viewers Aibowan.